Collecting a sputum culture. Provide for the client's privacy. Check the client's identification band against the label on the specimen container to make sure the client's name and medical record number match. Explain to the client that the specimen must be sputum, coughed up from the back of the throat or lungs, as saliva is not diagnostic. Wash your hands. Put on gloves and other protective equipment if indicated. Have a sterile specimen cup ready for the sample. Place the client in a standing or sitting position to aid in maximum lung expansion. Instruct the client to take several deep breaths and then cough deeply to expectorate the sputum into the sterile cup without touching the inside of the cup. Provide the client with tissue. Place the lid on the specimen container without touching the inside of the lid or the container. Place the specimen container in a plastic bag for transport to the lab. Dispose of used tissue in the appropriate receptacle. Remove your gloves and wash your hands. Record on the appropriate record that the specimen was obtained. Using suction to collect a sputum culture. If the client is unable to expectorate an adequate sample, obtain a sterile suction catheter and an inline sputum collection container. Provide the client with warm, humidified air for about 20 minutes if it is not contraindicated by his condition. Provide for the client's privacy. Check the client's identification band against the label on the specimen container to make sure the client's name and medical record number match. Explain the procedure to the client. Wash your hands. Put on gloves, a mask, and other protective equipment if indicated. Connect the sputum collector to the suction tubing and a suction device, and hook the suction catheter to the sputum collector. Lubricate the catheter with sterile saline. If the client is able to cooperate, have him take several deep breaths and cough. As the client is coughing up sputum, carefully insert the catheter either orally or nasopharyngeally into the back of the client's throat and suction the sputum into the specimen container. Dispose of the suction catheter in a biohazard trash receptacle and close the specimen container. Place the specimen container in a plastic bag for transport to the lab. Remove your gloves and wash your hands. Finish by documenting the specimen collection.